The reason we call this Wuhan Wednesdays is because this show and Dr. Boston really came into prominence during the early COVID months when we were being told so much about lockdowns and masks, and eventually we'd hear about vaccines. And Dr. Boston's the only one, at least in this state, probably in this region, that looked at the actual research and told you the truth about all that. But we haven't talked to you yet since the stunning rejection of the settlement offer put forth in Superior Court by the state of Rhode Island and the Department of Health to the school mask mandate lawsuit. From your perspective as a medical professional, what does that all mean to you?
Well, yeah, and I want to give you a quick update since it's a public. The documents have been filed, so it's public. Mike, the state is doubling down on its refractoriness, its idiocy. They're going back to trying to get the whole case dismissed now. In other words, they're not even willing, it sounds like, to go into some form of mediation to reach a settlement. It's not just they're actually trying to go back and get the case dismissed, which I don't even understand how that could work legally, because Judge Lanphier has already ruled that the case is not moot. So
right, he already ruled on the moot point. So what's their angle now?
I don't know. It doesn't make any sense to me. Doesn't make it.
Well, it makes sense. Yeah, they don't want people to discover that
they that part. Nothing, well, yeah. So that's what I would like.
Yeah,
that's what I would like to talk about. So when you go back over what the basic settlement was, which was to return to the normal regulatory order, where if they want to propose, if the Department of Health, in conjunction with the state, whatever, wants to propose a regulation where if there's another respiratory virus epidemic, that they would have the right to impose a mask mandate if certain metrics were met. That's fine for them to propose such a regulation, but they should be willing. And this is really the idea that Judge Lanphier, supposedly floated himself, which the plaintiffs quickly endorsed, which is they should just take such a regulation and bring it through the normal regulatory process, hold hearings, pro and con, and open to the public. Experts testify, but Mike, they don't have any confidence that they'd win the debate, so they don't want to subject themselves to that.
Right. That's well, I think there's more to it than that, Andy. And this is what I wanted to ask you. I brought it up with Lori very briefly, but you being a medical researcher, would have maybe even a sharper view on this. They mentioned, I think I heard somebody say in a report that Rich might have said it Friday, that the state said that their stakeholders didn't want to settle. So you wonder, all right, who are their stakeholders? Obviously, the defendants are the stakeholders, but here's my suspicion. I got to believe there was pressure from the CDC on this.
Oh yeah, we all believe that, Mike. We all believe.
All right, talk about that.
We all, well, yeah. This is the plaintiffs, the main plaintiffs, Rich Southwell, and Lori Gaddis Barrett, and Greg and I, had numerous discussions about this. The idea that they would reject such a simple settlement floated by the judge, it's hard to believe that McKee is so invested in all this, Governor McKee, that he wouldn't want to just settle the case just the way Judge Lanphier wants to settle the case. They don't want this lingering forever. They don't want it to become, a Dickensian lawsuit novel. They want it to be over with. So that we all surmise that the real pressure might have been coming from the CDC, if not Walensky herself, Rochelle Walensky, one of her minions, because it would set a very bad precedent if there were an open debate of the masking issue at the state level. it applies to all 50 states.
Right. Well, if the state was following the CDC lead and on this, and the state couldn't produce any medical data or scientific research to support masking or vaccines, that means the CDC doesn't have it either, and neither one of them want to be exposed, right?
Exactly. And now, Mike, you see there's a concerted campaign, and finally today, this is another sort of breaking thing today. It's breaking. There was a concerted campaign begun by a New York Times editorialist to attack the Cochrane meta-analysis. The Cochrane meta-analysis on masking, which is Cochrane is a very respected medical review which looks at evidence-based medicine. I mean, it's sort of the pinnacle of evidence-based medicine. And their review, which we've discussed on masking, which just came out in the past month or so, was very, very negative and said that neither for community prevention of respiratory viruses nor for even amongst healthcare workers using higher quality masks was there any substantial evidence of benefit. So there's a concerted campaign to attack Cochrane, including pressuring Cochrane, not the investigators who own the copyright to this investigation, which is a very important point, Mike. The Cochrane came out and the institution and is trying to distance themselves from the analysis.
Yeah.
So the investigators have pushed back fiercely. They gave an interview to an outstanding medical reporter, and they said this is an outrage. We're not changing anything. We own the copyright to that meta-analysis. Doesn't matter what Cochrane as an organization says. We're the investigators, and we stand behind it. And we think it's disgraceful that they're succumbing to outside pressure.